officer in ENU Mission Hospital, currently in pediatrics department. And as we all know, today is the World Health Day, and it's a day that we as individuals and medical professionals set out to celebrate health, and also to celebrate the importance of health and the absence of illnesses. So, we as individuals seize this day not just to celebrate health, but also to enlighten the public and enlighten them properly on the importance of health and how to properly take care of themselves, how to properly promote their health in terms of preventive measures to prevent the incidence of certain communicable diseases, how to manage chronic and long-term non-communicable diseases as well. So, as we know, the theme for our World Health Day is health for all. So, health for all meaning that health, it will strategies will be made in place to ensure that health is made available to people in different parts of the country and in different countries around the world. So it will not just be segregated or segmented to people in urban areas, but also the rural areas will have access to quality and effective health. So the WHO tends to achieve this by providing more primary healthcare centers in different rural areas around the world, so that they can have these individuals can have access to proper emergency services and also able to take care of minor ailments like in children, for instance, communicable like acute watery diarrhea, illnesses like cholera, illnesses like measles. So all of these things can be properly taken care of in the primary healthcare centers. Also for adults, non-communicable illnesses like hypertension, diabetes, even bronchial asthma, all of this can be properly managed in the primary healthcare center. So even in the obstetric section, so if incidences of conditions like postpartum hemorrhage, they can be brought to their minimum by creation of these primary healthcare centers, as they will be equipped with emergency services for taking care of these conditions. So I would like to talk about some common conditions and how we can take care of it as individuals, what we can do as individuals and as parents and relatives at home to whoever it is that presents with symptoms like suggestive of these conditions. So, for example, children having diarrhea, so we know that diarrhea comes with a lot of loss of fluid and dehydration. So, at home, we can prepare the ORS solution. ORS solution. So, and this you can put a sachet of ORS in 1 liter of water and ensure it is properly mixed, and then the child can be given for so we can based on the weight of the child or based on how the age of the child can be given appropriate fluid to replace what it is that he has lost, and also as the child is losing more fluid, he will be given more fluid pending the time that the child is brought to the hospital. So the child should still be brought to the hospital, but in the just to manage while the child before the child is brought to the hospital, this can be done. Then other things like measles, it comes with high fever. So things like paracetamol, tepid sponging with lukewarm water. All of this can help to bring down the temperature pending the time the child is rushed to the hospital. And it's also important for us to know the symptoms of these conditions as well and be able to bring them when appropriate to the hospitals. Malaria as well, so it comes with fever, so fever can be brought down with analgesics and also tepid, then the child is brought to the hospital. Self medication, there is no place for self medication. As much as possible we should try each and every individual should try to bring their children to the hospital when they present with things like this. So we at ENU hospital located in Ogidi, Anambra State. We have a facility that is well equipped and has different subspecialties ranging from pediatrics, obstetrics, surgery, different surgical subspecialties, orthopedics, orthopedics and trauma, even plastic surgery, ENT surgery, all of these ear, nose and throat surgery, all of these and more are present in the hearing hospital. Even in the field, in the department of medicine, there are also different subspecialties like cardiology, respiratory medicine, that's the chest physicians, the dermatology. So we have a vast array of consultants and specialists in different fields and different subsections of the hospital. There's even the dental clinic, there's the ophthalmology clinic. We have a vast array of clinical trained and personnel and consultants in their different subspecialties. So we are ready 247 to provide adequate care in terms when need be. So when need arises, we are always here. We work 247. We have the emergency services for emergencies. And so far, the track record has been superb. So we've all I recorded a lot of success rates. We have the best professionals and the best personnel here ready to serve you and provide adequate treatment where necessary. So you can think of any field or any specialty. The hospital is equipped with consultants and staff, nursing staff, the laboratory staff, all top notch and are well trained, providing proper and adequate services to ensure adequate patient care. So we are open 247, ready to hear and meet your medical needs and complaints. So as soon as possible, the proximity is close, and if it's something, if there is a medical condition that the person is suffering from, so after the first aid has been given at home, so as quickly as possible, patient can be rushed to this facility and proper treatment. You can be rest assured that proper treatment will be instituted and to give the patient or the person a high chance of survival. So going further, it's also important that individuals, especially the adults that have chronic medical conditions, know what these conditions are. So conditions like hypertension, elevated blood pressure, which are chronic hypertension. So when present, should if it is noticed for the first time, maybe on routine clinical visit, that the blood pressure is high, it should be rechecked after some days. So to be ensure that it is not just an instantaneous rise in blood pressure. So when it's rechecked and it is found out that the blood pressure remains persistently elevated, then medical treatment can be instituted. So normal blood pressure is it has a range. So from it's blood pressure less than between 90 to 129. So that's the normal blood pressure. Over 65 to 89 for diastolic. So that's the normal blood pressure. So anything below that is tending towards hypotension, and anything above that, so blood pressure above 130 and above to 139 over 90 and above. So blood pressure of 130 to 139 is already in the pre-hypertensive stage. So they call it pre-hypertension. So however, blood pressure from 140 over 90 and above is in the stage 1 hypertension already. So it's already hypertensive. So 140 and above over 140 over 90 and above is considered to be hypertension according to WHO, and it's in several stages and several grades. And people, when it's noticed that this blood pressure is persistently elevated, drugs should be given. So medical treatment should be instituted, and it's important that such person is regular on their BP check. So they should have maybe an automated blood pressure machine at home and should regularly take their medication as at when prescribed, because this chronic illness, they are silent killers. Blood pressure, hypertension doesn't present with symptoms, it only presents with complications, things like stroke, and depending on where the blood vessel ruptured or where the stroke occurred in the brain, it could be life threatening, because if it occurs in specific areas where the respiratory centers and other things are located, it could be life threatening. So it's important that proper management, proper follow-ups, proper medication adherence is strictly adhered to. Also things like diabetes as well, regular blood sugar checks once it is diagnosed, whether with a fasting blood sugar, using the fasting blood sugar or like glycated in A1C. So once it's diagnosed, it's necessary that it is properly managed. Regular blood sugar checks daily or alternate days, or at least 3 times a week, at least 3 times a week should be done, right, to ensure that it is properly monitored. And also, where necessary, treatment using the anti-diabetic medication should be given and should be adhered to, right? As well as diet. Attention should be placed on diet. Starchy foods, sugary foods should be avoided totally. Processed foods, all of this should be avoided. Fatty foods, all of this should be avoided. Rich in high cholesterol, high level of LDL cholesterol should be avoided. More of natural food should be given. Fruits and vegetables should be given. Grains as well in adequate proportion, adequate quantity should be given. So, and all of this should be backed up with proper physical activity, at least 30 minutes physical activity daily. Doesn't have to go to the gym, but at least walk around 30 minutes, burn some of this fat. So all of this would help to properly manage, as well as bronchial asthma. All of the it should be, if person is noticed, the individual is noticed to have difficulty breathing worse at night, associated with cough and maybe other features of allergy like red eye may or may not be present, running nose, all those things may or may not be present, or hives and skin illnesses, it should be suspected. And then, or when there is a family history of things like that, and then they should be taken to the nearby hospital as quickly as possible. So relievers will be given in the hospital, and then they can tests can be done to diagnose asthma. When diagnosed, they should be regular on their medication. Their They'll be giving controller medications as well as inhaler medications, and be regular on them. So these are some of the medical conditions. There are a vast array of medical conditions, but these are some of the ways we can ensure health promotion of the common medical conditions we have here. And it's also important that we our health seeking behavior is improved. We should change the way we feel about health. We should be more proactive in seeking health as individuals. So whenever we notice anything, we are noticing any changes, whatever it may be, even sometimes some of these nowadays incidence of breast cancer has been on the rise. So once things like regular self breast examination should be done, whenever skin changes around there are seen, you can easily come to the hospital, lay your complaint and allay your fears to know if they are, if it's actually something to be said. The physician will examine, and if it's something that needs further examination or further investigation, it will be done so that they can be picked up early. So we should be more aware of our health. You notice blood pressure elevation, notice changes in your health, come to the hospital. It will not hurt. Come to the hospital. ENO hospital is always open. We have the best family. We have family physicians, consultants, specialists in family medicine. So all of these people are available in different subspecialties to meet your needs and be able to diagnose all medical conditions, as well as provide treatment where necessary. So we should be more careful and more concerned about health. So whenever we notice any changes in our health, we should come to the hospital and not self-medicate, so that we can pick these things early and treat them well. So as a take-home message for this World Health Organization Day, so let us ensure that we give our health priority, right? There is a proper saying that is the person that is healthy that can eat his wealth, right? So if you are not healthy, you can't eat whatever it is you think you have, whatever wealth it is you think you have. You need to be healthy to enjoy whatever wealth you have. So take your health as priority. Always come to the hospital whenever you have any ailment or you feel changes in your body. So let these things be picked up early. Take your health as priority. And I wish you a better health, long life, and a happy World Health Day. So from my end, I will be saying take care, goodbye for now, and have a wonderful and blissful year ahead. Thank you.